Hi folks, this is Dan with Dan's Retirement Journey on Philippines Bound. Well, this is the Sunday update on the house build. Things are going great on the house. Don't have much to report because we got rained out for the majority of this week. Some of you that have been watching other channels where they're building houses in the Philippines have also discovered that they've been rained out. So there are a couple of people building houses in Bohol and other areas, other islands, and they didn't get much work done. They had to take 3 or 4 days off due to the rains. It just like opened up, the heavens opened up and dumped buckets of rains on some of the Philippine islands, and that put a halt to the house building. But we're making progress on the roof, on the trusses. We got a couple of days worth of work in, and we're getting ready. We're pretty close to finishing up. I think we have one more week's worth of work on the trusses, and then we're going to start putting on the roof. But we have yet to receive a quote on the cost for installing that roof and the material costs, mainly because it's the Philippines and they move a little bit slower than folks in other countries. But that's because they're careful, and they want to make sure they don't make any mistakes. And so we should have that quote soon, coming up this week maybe anyway, and we'll share that with you once we have it. And we'll also share what we selected for the roof, what type of roof, and what color we're going with, and that type of thing. We put up a very simple steeple roof, and that's because I'm a simple kind of guy, and so long as it doesn't rain inside the house, I'm good with that. I know that there's a trend in the Philippines to build all kind of fancy roof, but I was concerned about the labor costs connected with that, since the welding it would get kind of intricate, and that means more detailed, which means more time in order to do the welds on the roof. So we went with a simple steeple roof, sort of A-frame, that kind of an angle, and that was to preserve labor and material costs. It's not too intricate. It's very simple, but it's nice looking also. And so you'll see. When it's finished, it'll look just fine on that house. So I also want to talk a little bit about health insurance when you're living overseas in the Philippines. That question keeps coming up time and time again. You have some excellent vloggers out there that are doing a great job on supplying information. But every time I learn something new, I'd like to share it. So I want to talk a little bit about how I plan on working this when I move over to the Philippines. So the options are, when you turn age 65 and you retire and you leave the country, you're still required to have, you have to have, Medicare and Medicare Part B. There's a premium payment that's associated with Medicare Part B, and that's where the dilemma comes in. For me, I know the minimum premium payment is going to be about $145 per month and or more. And so the whole thing here is I have to decide whether I'm going to pay the Medicare Part B premium or opt out. Opt out because I know that I most likely won't be returning to the Philippines, or to the United States from the Philippines. But here's the thing. Do I really know that? I mean, things could happen. I could get sick on one of my visits to the United States while visiting my kids and my mom, and then have to go to the hospital and need outpatient care. And of course, I'd be grateful then if I were paying the premium payments on Medicare Part B. So I think that I made the decision to go ahead and pay the premium payment, since we can't look into the future. Most of us don't have crystal balls. Some of us do, crystallized balls, that is. And and I think it's probably a stupid idea not to have Medicare Part B if you plan on returning to and or visiting while you're in the Philippines at your during your golden years. Okay, so let's move on. So how do you protect yourself when you're in the Philippines? Because the Philippines doesn't accept Medicare. No, you have to have the national health care insurance, and you also should have private insurance. So the premium payments for PhilHealth in the Philippines is something like $350 per year for a foreigner like me, an expat like me. That will get me through the hospital door and at least get a bed and the start of the delivery of services without delay. Most of you may not know that in the Philippines, you usually don't get service until they can figure out how they're going to be paid. So that means insurance and or cash, and it's pay me up front. They usually want a deposit before even they start to provide services. So how I think I'm going to work this out. PhilHealth, though, at 350 pesos, 350 US dollars per year, probably about 17,000 Philippine pesos, get you through the door and get you started with their treatment on what might be ailing you. And so to supplement that, I most likely will have a private health insurance, but they don't come cheap, especially after you turn age 60 to 65. Once you're in that zone, the price of health insurance starts to go skyrocket because they know that the odds are you'll be taking advantage of it at some point. So the ones that I'm impressed with so far, the private health insurance companies, are Pacific Prime Health and Pacific Cross Insurance. I recommend that you check both of those out. Prior to leaving for the Philippines, you should actually have those in place. And if you don't have those in place, make sure that you get a travel insurance that covers the healthcare costs at least for 90 days while we're in this global state of calamity. The deductibles on those insurance that I'm looking at are kind of high. So the annual deductible on one of the policies that I saw that I'm very interested in is $10,000 per year, which may sound like it's high. And it is kind of relatively high when you're compared to U.S. costs, but maybe not so much when you think about that you should always have cash in reserve for healthcare emergencies. Let me give you an example. I don't know how much healthcare costs for open heart surgery or bypass surgery in the Philippines, but I know in Thailand, in Bangkok, at Bangkok Hospital, it's around an average cost of $22,000 US. So if you have $10,000 deductible, and then the insurance can cover the other $10,000 in costs. Yes, the policy that I'm looking at does cover you no matter what country you're in if the event occurs or you want to travel to it to get medical services done. They'll cover you in Southeast Asian countries or Asian countries. So me traveling to Bangkok, if I feel more comfortable having treatment there, is very likely because I know that they provide some of the best medical care in the world. That's Bangkok Hospital. If you want to go online and gather up some information about the services they provide. So $10,000 is a given. They'll have to have that in the bank to use as the backup for the health insurance, either to take care of outpatient care or inpatient care if under $10,000. Then the insurance will cover the rest, and PhilHealth will cover the rest. Again, if I wasn't clear, PhilHealth is a national healthcare insurance program in the Philippines. So if you need more help on understanding how that works, I would say take advantage of Steve at the Philippine Information Channel.